Good evening, everyone. Hope you can hear me, yeah? Let me know if you can hear me. Good evening, everyone. Good evening, everyone. So, hi, Jerry. You're watching from Reading. Um, Call ate, ask her to join. Hi, Chloe. Hi, Gerard. Hope you can hear me okay, yeah? If you can type it on the chat box if you can hear me okay. All right. Let's wait for a couple more people um to join us. Good evening. Good evening. I know it's a very short notice, but thank you for joining me this evening for another live stream. I know last week okay, thanks Gerard. I know last week we didn't have any live stream because I was kind of busy last week, so I hope it's not too echoey, yeah? Because I can hear myself. There's um an echo. All right. So tonight we will be discussing what are we going to discuss? What are we going to discuss? So some equipment about the OSCE. So I will be discussing. I mean the equipment that you will be you might be seeing during your examination. So I think this will be useful because I know some of you probably you are doing the training or the examination, or you will be doing the examination independently. I know. So um, it will be this session will be valuable for you. If you know this already, you can still join us. Why not? You might learn something new this evening. So if you're new to my channel, my name is Emer Diego, and I normally teach OSCE. Um, so we normally do the live stream every week. So normally it's a Wednesday or a Thursday. And of course, if you haven't followed me yet, please do follow me on my social media um, platforms, Facebook, Instagram, and of course Twitter, and of course my TikTok. There you go. Um, for those people who's following me on TikTok, hopefully you are enjoying some videos there. And what else? And of course, please do subscribe to my channel, Emer Diego, and click the notification bell so you'll get notified if we go live. Okay, so because sometimes I don't normally announce if we're going live in advance. Okay, so um, good evening. So if you can put on the comment section which part of the world you're from, or which part of the UK you're from, and when or where you're going to take your examination. Good evening. Another cold evening here in the UK. So if you're watching this, um, thank you for watching this. If you're watching this late, um, thank you for, thank you for subscribing. I think I saw my YouTube. Um, I think only 20 what they call this, like 20% ish are actually subscribed to my channel who's watching. Okay, so please do subscribe and click the notification bell. And I always look forward hearing your stories about your exam, and of course, whenever you pass, I know some of you are actually commenting on my channel, so um I'm thankful for you sharing those milestones, those information, those good news. So and I think my email is somewhere. You can see it on my YouTube channel. If you have any questions, you can send me your question. You can email your question. I'll try to respond as soon as possible because I do receive loads of emails. So um, I'll try and respond as soon as possible. So okay, let's wait for a couple more people to join us. Again, this video, the recording of this live stream will stay on my channel, so you can still go back and watch it. But of course, hopefully you can join us now live. So we'll be doing some questions, and hopefully you can answer my questions. And of course, we'll be doing what do you call this a final coaching next weekend. So the 2nd and the 3rd of December. So if you want to join, the link is on the comment section. It's on, yeah, I think it's in the comment section. The pinned comment is there, so just click it. It will take you to Eventbrite, okay, the website where you have to register. And of course, I'm running for the London Marathon next year. So of course, if you can, please donate. I'm supporting Victa. That will be the charity I'm supporting next year. So all the proceeds will go to them. Okay, so thank you in advance. What else? Any other commercial? I'm trying to think any other commercial. Yeah, please do join our final coaching next week. Once you register, you will also receive our Oscar workbook. Um, and it's online, so it's 2 day. I will be the one teaching on those 2 days. All right. Okay, so let's make a start. Let's wait for more people. Wait for more people. If you can, hopefully, if you can like this video, of course, like this video and then share this video. Invite your friends. It's just for free. They can join anytime. All right, let me just change the screen so you can see what I'm going to discuss. Hang on. Give me 1 second. All right. All right. Hope you can still see me. Thank you again for those people just joining us live. For those people who will be watching this video in the future, thank you for joining. And of course, thank you for subscribing to my channel. And please do follow me on my other social media accounts. All right. So hopefully you can see this one. So we will be discussing the equipment for the OSCE. So probably some of you know this. For some, probably you haven't seen this document ever. So this class might be boring because we will be just discussing about the equipment, but let's make it fun. Hopefully you can help me answer. I mean, I'll be asking some questions. Hopefully you'll be able to answer some of my questions. Okay, as always. I'm trying to look for the. I'm looking at myself. There you go. All right. Um. Right. I'm looking for my. Right. Um. Just a quick question. Is this? If you can put it on the comment section. Is this your first time joining the class, or you've been here before? You've joined previous classes. Um. If you can share it on the comment section. I know in the previous classes I mean we had some usual attendees, but let's see if we have new people joining us this evening. All right. Okay. Okay, shall we start? Okay. Just put it in the comment section if you want to introduce yourself before we start. All right. So again, tonight we are going to discuss about the equipment for the OSCE. Gerard is his first time. So we'll be discussing the equipment for the OSCE. So Emma, where will I find the document on the screen? So if you go to the website, the test center website, so Oxford Brooks, Northampton, Ulster, Northumbria, you will see this document. So This document is called um, equipment list. Okay, so the version I'm showing on the screen is version. What's our version? It's version. Oh, where is it? It is version. Hang on, I'm looking for the version. This one is version 1.6, okay? So the marking criteria is now is we have a new marking criteria. It's I think version 2.2, but the equipment list it hasn't changed as of yet, okay? As of today, what's today? What's the day today? The 22nd of November 23. So it's still version 1.6. But yeah, so again, as I've mentioned this a million times before, always check the website before you go to your examination because they do update the materials often. So again, as of today, as of this recording, we still have version 1.6 for the equipment. Again, just for the equipment. But for the marking criteria, we have a new version. Okay, so we have version 2.2 for the marking criteria, which was published a couple of weeks ago. I think most of you you learned that information on during our live stream. So um there is a significant number of people who were surprised that the marking criteria was changed. Okay. So luckily they attended our live stream. Okay. So going back to this document, so this document is called OSCE Test of Competence 21, equipment list, all fields of nursing and midwifery. So this evening, we'll focus more on the equipment for adult nursing. Okay. All right. So there is a disclaimer here. It says here, below is a list of equipment likely to be used throughout the OSCEs. Care has been taken to ensure this list is accurate. However, due to availability, sometimes different brands and variants are stocked. Please take some time to read about the equipment and their function. Of course, there are times wherein it, I mean, it might be different um, when you do it. It depends on the availability of the equipment on the day of the examination, as mentioned on the statement. So, it may be different variant on the day of your exam, or it might be a different brand, of course. But again, the equipment is still work the same. If you're unsure how to use the equipment, of course, it is important to ask your assessor before you start. Again, before you start the station, it is important to ask your assessor. Normally, the assessor will they will ask and confirm with you um, whether you have any questions or doubts before you start. So, again, if you don't know, if it's your first time seeing that equipment, make sure to ask the question before you start. Okay, they won't bite. Okay, so you ask before you start. All right, let's start with the first equipment. Okay, so we have the apron. So for those people who's watching us, can you please probably put in the comment section which scenarios or which stations do you think will be or you will need an apron? Okay, can you give me some like station or clinical skills that an apron is required? Okay, give me a station. What stations do you think apron or wearing an apron is required? Let's see. So whilst I'm waiting for your answers, please do subscribe on my channel. Let's see. Give me some answers for those people watching us now. Which stations do you think you will need apron? So Gerard said ANTT. That's correct. Well done. Any other question? Any other question? Any other answer? So let's see. Let me just check the marking criteria. Okay, let's see. What are the stations we think we will need um what do you call this? An apron or wearing an apron or PPE. So let's see. Definitely you need it during your assessment station. Do we need it? No, we don't need it. Okay, we don't need it. I know if you've watched our video about A2 assessment because it was published during pandemic. During pandemic, it was a requirement to wear PPE. But now on the latest, of course, marking criteria, um, PPE is no longer required for assessment station. So you don't need apron during assessment station. Planning, we don't need it. Of course, we will just write. Implementation station, we don't need an apron. And of course, evaluation station, we don't need apron in that station. So most likely, we will need the apron for our clinical skills. Let me give some example. Or yep. So any station that, of course, will expose you to bodily fluids. So such as IM, subcut, what else? NG insertion, of course, suctioning. Those are the sample, I mean, example of stations wherein you are required to wear apron or PPE. So, what else? Okay. So, how will you know if an apron is required? It will be written on the criteria. Again, the marking criteria will tell you if you need to wear an apron. If it's not written on the marking criteria, you are not required to wear an apron. So it is important to check your criteria, check the latest marking criteria from the website. Again, the marking criteria will tell you if you need to wear PPE or apron in particular. Okay? So please do remember that. Question: as you can see on the screen, it's colored blue. Have you ever thought, um, I mean, in terms of, I mean, have you ever thought, like, is there a reason behind colors, or just they just put a random color here and then they, um, so sorry, there's a little alarm. So, have you ever thought about the color? Okay, so I don't know. Have you ever thought about that? So, blue. What do you think blue means for the apron? In terms of the apron, whenever you wear an apron colored blue, what do you think it signifies, or what's the meaning of it? Do you think, have you ever thought about it, or did you just think that they just put a random color there? Okay, what do you think blue signifies in terms of the apron? Okay, for those people who's working probably in the NHS, because of course I know some of the people who's watching this video, you work in, say, private or social care homes. Probably it's kind of different there. Um, have you ever seen a different colored apron? Let's say, have you ever seen a green apron? Have you ever seen a red apron, a yellow apron, a white apron, or blue apron? Have you ever thought about this, or no? Let's see if you know green. Have you ever seen a green apron? What do you think? When do we use that? So please do type it on the comment section. And for those people who's watching this late, of course, pause the video and try to answer. How about red? How about yellow? Let's see. For those people who was kind of shy to answer, try to think of your answer. But of course, if you can comment your answer, why not? No, no thoughts. Let's see. So if you go to no guesses, All right. So if you go to the NHS website, not NHS website, it's called, if you go to the, where is it? Yep, NHS England website, you will see the document called National Standards of Healthcare Cleanliness. Okay, so you will see the color codings of apron there. Okay, the national color coding scheme. So according to that document, if we see blue, okay, an example of which is the apron, it means we use this for general areas including wards, departments, offices, and basins in public areas. Okay, so that's that's the time we use the blue colored apron. Green, if it's green for catering departments, for wards, for kitchen, and patient food services at ward level. So that's why I remember when I was working in the ward before, if it's lunchtime, when we give food to the patient, or whenever we help, whenever we help them with their meals, we normally wear the green apron. And of course, yellow would be isolation areas, definitely. Okay, I don't know if have you ever seen a yellow apron before. So those are the some of the color codings for your apron. Of course, probably white. You normally see this in the wards as well. Okay, so during the examination, you might see a blue or a white apron, which is fine. Okay. And more question: do we see other colored aprons during the exam? You will not see other colored other color of aprons during the examination. It's probably just blue or white. Okay. Again, it depends on the availability of the equipment on the day. So let's move on. Next is we talk about the clinical waste bins. Okay. So during the examination, we have two types of, you will see two types of bin on the day of the examination. It's either the yellow, and which is the clinical waste bin, and of course the domestic waste bin. Okay, so um, black. Okay, the black bin. So I know. Can you give me some examples? So what are the? I mean, what will you throw on the yellow bin? Okay, if you can give me some examples. Okay, what will you throw or on that bin for the yellow bin? If you can give me some examples. And of course, what will you discard or throw on the black bin? If you can give me some examples. Let's say I'll give an example. Let's say I'm trying to think. Let's say gloves. Okay, where will you discard the gloves? So gloves, of course, the yellow bin, definitely the clinical waste bin. So, um, all clinical items should go to the clinical waste bin. Okay, so if you're in doubt, that's your bin during the examination. Of course, domestic waste, let's say paper, let's say um, pen, any other any other items that is not clinical. Okay, so that is your yellow bin. So Emma, is there like a chance of? I mean, is there a chance of me failing the OSCE because I discarded the material or the rubbish on the wrong bin? Of course, yeah, there will be a chance of course you failing if you discard the equipment or the rubbish um on the wrong bin. Okay, so please do remember that. So most of your what they call this, sold articles will go to the yellow bin, to be honest, for the examination, because um domestic waste is very few during your examination. Say apron, the gloves, it will all go to the clinical waste, because those are the used items during your examination. All right. Any other questions for the yellow bin? So again, if you're in doubt during the exam, I do suggest just throw it on the yellow bin. Of course, but of course, use your critical thinking, definitely. Yeah? Use your critical thinking. All right. Disinfectant wipes. So this one, the green one on your screen is called the universal wipes or the disinfectant wipes. So this one is commonly known as Clinell wipes. Okay, so the green one is the Clinell wipes. I don't know. Have you ever seen a red Clinell wipe? Um, do you know what is that for? The red Clinell wipes. Have you ever seen one before? Probably during your practice, you always see the green, okay, the universal wipes. Have you ever seen the red wipes? And do you know what is that for? Just thinking if you've seen one before. Anyone? I'm trying to see if I check if I can show it on the screen. Okay. So if you haven't seen one before, sorry, I'm just checking if you have any. I'm just checking if I can show it on the screen. I don't think I can show it on the screen. So yeah, so there, if you haven't seen a red canal wipe before, you will not see this on the examination. Don't worry. Yeah, normally we use it for it's a sporicidal wipes. Yeah, it's a sporicidal wipes, and um, of course, like me, I'm from the Philippines. We don't normally use this back home. That's why when I first saw this, I'm clueless. Okay, how to use this or what is this for? So red wipes is for sporicidal, and normally, again, FYI, to use the red canal wipes, you have to activate it. You have to wet the wipe with water under tap or dip into a bucket. Okay, so that's how you use it because don't use it dry. Okay, if you ever see a red canal wipe to activate it, you have to wet it. Okay, don't use it dry. Okay, so when you see one, when you open it, normally there the odor is very foul. Okay, there is a strong chemical odor. Okay, um when you open a red canoe, you can smell it. Okay, and normally when you use it, it's dry. But for the green wipes, um, when you open it, it's wet. Okay, it's wet. You don't need to do anything else. Just you can just use it straight from the packet. Okay, but the red wipes, you have to wet it. I mean, it's not part of the examination, but of course, it will be useful for you to know. Okay, because when I started working in the UK, no one. I mean, I just learned it along the way. Okay, all right. You have to wet it for you to be able to use it. Okay, so that's your green wipe. So, what scale do we think we will be using the canal wipes? Okay, can you give me a clinical scale which you think you will be using the green clinal wipes? Let's see if you know which scale, which clinical scale you will be required to use the green clinal wipe. There's only one scale. Any guesses or any answers? What scale are you required to use the green clinal wipes? ANTT. Thank you, Gerard. So ANTT, there you go. So Emmer, how about the other skills? How about the IM, etc.? Don't we need? I mean, do we need to clean? Do we need to clean? I mean, the tray. Normally during the examination, the assessor will just tell it's clean and ready to use. Yeah, for the trays. But for there is one particular skill like Gerard mentioned, and of course, comfort. Thank you for answering as well. To disinfect the trolley, which is the ANTT. Okay, so the only skill that you will be using this particular equipment is ANTT as of today. Okay, as of today. But again, you'll never know if you're watching this video in the future. Um, Probably there are changes. All right. Okay. So that is your and of course no. Let's move on. Okay. Face mask. Okay. Let's see. Let's think. Which skill do you think face mask is required, or which station? Can you name the station where face mask is required? Let's see. So as you can tell, normally during the live stream, I don't have a presentation because we are just studying together. Okay, so I don't have a presentation because I want you to think, and of course, we're just studying together. That's the essence of our live stream. But we are organizing a proper class under the Philippine Nurse Association. Hopefully, we will be able to launch the class very soon. Okay, so I will be inviting some other OSCE educators across the country, um, and they will help me deliver the class in the next coming weeks. All right, so can you give me a station, or can you name the station wherein face mask is required? So the station is what you're thinking is correct. Okay, so it's your suction. Okay, so nasopharyngeal suctioning. Definitely, you need to wear a mask. Okay, so any other stations do you think? Put in the comment section. All right. So next is the hand sanitizer. So of course, most of the OSCE stations you will be using a hand sanitizer definitely. So it's this one. The one on the screen, I think what's the brand? It's Cutan, but it's not always the brand. Okay, during the examination because as you know, we have different brands of hand sanitizer. What are the common brands of sanitizer you've seen before? I think I have a small sanitizer here. Um, So there are plenty of brands that the test center could possibly use during the day of your examination. Okay, so one of which is the one on the screen. What are the other brands? Can you name one? Okay, so and one tip that I can give you for the sanitizer is it can be sticky. It can be very sticky on the day of the exam. So um so this is important before you don your gloves, whether it's the clean glove or sterile glove. Make sure to dry your hands properly, okay? Because um hand sanitizer, the tendency it can be sticky, okay? And then don't put too much, okay? Because sometimes people because of course they sometimes exaggerate the amount of um hand sanitizer they're actually applying on their palm. Okay, so don't put too much, okay? Just enough for you to clean your hands during the day. Again, don't put too much because it can be very sticky, which you will find it challenging once you done your gloves, okay, your sterile or your clean gloves. Okay, just don't put too much. And of course, during the exam, you have options. I know during your practice, some of you are just being resourceful. Okay, so whatever you have in front of you, that's it. Okay, I know some of you are doing this independently. Okay, so you don't have much. You don't have loads of resources. um, if you only have small gloves and that's it, if you only have one pair of gloves and that's it, you just reusing it. But during the day of the examination, trust me, there will be different sizes of gloves. Okay, so they have extra small, the medium, the large, and of course extra large. You can select. Okay, so you can select because of course, I mean, How much is the examination? It costs like nearly 800 pounds. So definitely use the appropriate gloves. Okay, so you use the appropriate gloves. And um, in the test centers, they normally use a latex-free glove. Okay, before you start, the assessor they would normally ask you, do you have any allergies with latex? Okay, or they normally tell you that all their equipment will be latex free, because of course they also need to consider if you have any allergies with latex or etc. Okay, um so that's your non-sterile gloves. Okay, so again, during the day of the exam, you have the opportunity to select your glove size, because let's say this hand, I mean, my hands are really big. Okay, it's ginormous, so it's difficult for me to wear small gloves. I know some of you have small hands, and of course it will be, I mean, it will not be ideal for you to wear extra large, because of course it will affect your performance on the day. All right, let's move on. Protective, what I call this, protective goggles. So which station do you think we are required, or you will be required to wear goggles? Okay, if you can type it on the comment section, which station do we think goggles is required? There's only one station. As of present time, there's only one station that you are required to wear goggles. Which station is that, do you think? Thank you for those people who's watching us and joining us this evening. Yeah, so please do subscribe on my channel, and please do like this video, and of course share this to your friends and invite them. We'll do another live stream next week. Okay. I will check my schedule, and then probably we can do it like on a Wednesday or a Thursday. We normally do it Thursday, but let let's see. I will just announce. Make sure to subscribe on my channel so you know when I'm going to um go live. There you go. So which station? The station is nasopharyngeal suctioning. There you go. So because of course bodily fluids, definitely. All right, Sharp's Bin. Okay, the next one, Sharp's Bin. Of course, I'm guessing you've seen a Sharp's Bin before. Okay, a Sharp's Bin. So it is important to have your Sharp's Bin beside you or close to you during certain stations. So if you can try to think, what stations do you think Sharp's Bin is required? Okay, can you name some station? Can you name the stations wherein you need to bring the sharp spin with you? Okay, can you give me stations? Can you name the stations? Give me one, or give me all the station that you think bringing the sharp spin is required. All right, thank you. So IM, of course, administration of intramuscular injection. You need to have your definitely your sharp spin. What else? Subcutaneous injection, definitely. What else? Of course, what else? Um, your blood sugar monitoring. Definitely, you need to bring your sharp spin with you. Okay, what else? What other station can you think of? Did I miss anything? If I miss anything, just put it on the comment section. All right. So the most important thing whenever you have the sharp spin, make sure it's not full. Okay. So I don't know if you ever seen one before. Definitely, the sharp spin, there will be a line which tells you. So if the contents of the sharp bin is on a certain line, normally if it's two-thirds full, it will tell you to close the sharps bin. Okay. So once you close it entirely, you can no longer open it. Okay, you can no longer open it. So of course during the examination it won't be full. Definitely, yeah, it won't be full because you won't be able to use it. Normally the assessor will be responsible on checking it. But of course, in real life, definitely, if it's if the contents of the sharps bin is beyond the line, okay, there will be a line there which tells you that you can no longer use it. Okay, so and you have to close it and discard it properly. Okay, so Again, for the shower's bin, you have to close it properly. Once you close it entirely, you can no longer open it. Okay? So in practice, we normally just close it halfway, okay? Not entirely, because once you close it, you can no longer open it, okay? So in practice, we normally just close it like halfway, so at least um I mean the contents won't escape or whatever. Okay? So, and of course, be mindful of the line, okay, or the contents, okay? How full it is. Thank you. How do know? I don't know if I don't know if I can say your name properly. I will try. Chin Pembe. There you go. She said goggles will be used for of course nasopharyngeal suctioning. Thank you. All right. Next question. I think if you've been following our live stream, I did mention this before. So if you separate the needle from the barrel of the syringe, the needle will go to the sharps bin, and then the barrel of the syringe will go to the yellow bin. Okay, but if you don't separate the two items, let's say the needle is still attached to the barrel, both will go to the sharps bin. Okay, again, if you separate the needle from the barrel, the needle will go to the sharps bin, because remember, the barrel of the syringe is not a sharp object. Okay, it can be a pointed object but not a sharp object. So the barrel will go to the yellow bin. But again, if you don't separate the two items, definitely um, all will go to the sharps bin. That means, remember your flush, your pre-filled syringe. Remember, the pre-filled syringe, it doesn't have a needle. So definitely a pre-filled syringe or a flush should be discarded in the yellow bin. Okay, because that is not a sharp item. Okay, so please do remember that. Okay. Um, remember for your IM, no more resheathing. So once you remove your needle from the barrel, the needle will go to the sharps bin, and then the barrel, of course, once you've finished administering your medication, the barrel could go to the yellow bin. Again, if you don't remove the needle. If you remove the needle rather. Next, so the Bedford doll, it is the full-size mannequin that you might see during the examination. So typically during the exam, the doll, the doll is lying on the bed. Yeah, lying on the bed. So you will be performing the skills um, with the doll. Okay. Normally, actors for assessment and implementation station, normally actors will just sit on the chair. Okay, so they can move to different rooms easier. Okay, so the doll will normally lie on the bed. Okay, so you can form whatever skill you are required on the day. But the actor for assessment station and for implementation station, they normally just sit in the chair. Okay, so that's how they do it on the examination. Of course, if there will be no actor, which is very rare now, you will be performing it with a doll. Okay, because I know I heard some cases wherein I think on the day of the examination there are no actors, but it's very rare, yeah, because the test centers, they're really trying to have an actor on the day of the examination. And remember, on the day of the examination, the actors are actually actors, so they are paid to act, so they're really good with acting. Okay, so they can be really convincing on the day of the examination. I know whenever you practice, you're just practicing with your friend, okay? And your friend is not too good with acting. Or sometimes you are practicing with your OSCE instructors or facilitators. So some of them like me are not good with acting really. Okay, so the acting is bad. But of course, during the examination, the actors are really paid to act, so they're very good. Okay, so they can be really convincing. They might cry, they might laugh, okay? And you might think it's genuine. All right. So female catheterization. So you will see this equipment or this piece of equipment, of course, during your RUC or CSU. Okay, so when you remove the catheter, you will be removing the catheter, of course, from this um, mannequin. For CSU, definitely the catheter will be attached to this mannequin. Okay. Injection pad. Obviously, you will be seeing the injection pad if the um, skill that you have to perform is either IM or subcut. Okay, so during the examination, if you will be given IM or subcut, expect that you will see an injection pad. Okay, so you will not inject the medicine on the Bedford doll. Okay, you will not inject the medication on the Bedford doll. This doll. Okay, because of course the doll will be expensive. Normally, this full size mannequin, it normally costs around like more than 3,000 pounds. So it's expensive. So that's why they purchase a separate injection pad. So which is intended to inject like medications, right? So Emer, question: is there like a chance me getting IM and subcut at the same time? Um, there is less chance of you getting two injections at the same time. Okay, so if you get IM, the remaining three skills will be a different skill. Okay, so let's just recap. Okay, so for those people who probably they started their OSCE training, so during the examination, there will be how many skills? 20 plus 22 skills, yeah? And out of 22 skills, you have to perform four random clinical skills, okay? So out of 22, is it 22? Correct me if I'm wrong, yeah? Put it in the comment section if I'm wrong. So there will be like 20 plus or 22 skills, and then you need to perform four random skills on the day. Okay, so if you get IM, it's unlikely you will get subcut as well. So the three remaining skills will be a different skill. Okay, because um although IM and subcut are two entirely different skill, I mean, of course there are components there which is the same. Okay, so that's why you won't get IM and subcut at the same time. All right, so but again, you'll never know. There might be a chance. Okay, for there will be a chance definitely, but of course, it's important to practice both. All right. So next, hopefully you're enjoying our session. Yeah, hopefully you're learning something. Okay, put it in the comment section if you learned something so far. If not, just chill with me. Normally our session is just chill. I'm just talking. All right. So next, so lower abdomen mannequin. I know the spelling is wrong. So there are two ways of spelling the mannequin, the word mannequin. Yeah. Is it correct? I think it's correct. Is it correct? There, it is correct. All right, yeah, there are two ways of spelling on how to spell the word mannequin. Um, sorry, my eyes are really bad. Okay, so which scale do we think you will be seeing this particular mannequin, the lower abdomen mannequin? Okay, um, let's see if you can put in the comment section what scale do we think you will see this particular equipment or this mannequin. That's correct. Okay. So it's your administration of suppository. Okay, well done. All right. So for I mean for your administration of suppository, you will see this equipment. Oh, that is why, Emmer, on the marking criteria it says there, isn't it? I don't know if you remember this. Do not move the mannequin. Okay. Well done. Thanks, Jared. So that is why on your marking criteria it says there, do not move the mannequin. The reason for that is because you have this mannequin already facing the left hand side and already positioned this way, okay, the one on the screen. So that's why when you go there, when you see this mannequin, most likely you will be doing the suppository. So Emma, how just a question, yeah? How will you know what skill you will be performing on the day? So when you go to the test center, when you go to the room, when you go inside the room, you will see the equipment. Let's say if you see this mannequin, most likely you will be performing the suppository. If you see a mannequin for the NG insertion, most likely you will be performing the NG because I mean they normally put the equipment necessary for the skill that you are required to perform. Okay, so when you enter the room, you will see what you will see. Most likely, that's the skill that you are required to perform on the day. That's why it is important to practice all the skills. Okay, practice. I know probably some of you are wishing I wish I get the fluid balance. Okay, but of course, um, we can only manifest. But again, we don't know. At the end of the day, it will be a random skill. During my time, yeah, just a short story. During my time, because I took my OSCE couple of years ago, we never had fluid balance during my time. We only had how many skills? Um, so during my time, I know at the moment you have 22, right? During my time, you will get jealous. We only had 7 skills during my time. Yeah, we only had 7 skills. What are those? Let me try and recall it. So during my time, we only had IM, we only had subcut. What else did we have? We also had ANTT. ANTT was there since the beginning. We had catheterization. So I know catheterization is no longer um I mean, no longer part of the examination. But yeah, during my time, there was catheterization. So IM, subcat, catheterization, BLS, um, peak flow. I think that's it. Those are the skills before during my time. I know you are jealous. You have 22. Okay. So definitely, I do feel that your examination is really difficult. Okay. But the downside, when I did my examination, if you failed on something, on let's say a particular station, you will be resitting all the stations and you will be given new scenario. Okay, that's the only thing. Okay. But now, of course, the advantage is if you only fail on a particular station, you will be repeating the same thing. But again, of course, I don't. I want you to. I mean, I want you to pass the first time. Okay. That's why kudos to all of you, okay? Of course, special mention to those people who are doing this independently, okay? So, it will. I know it's really difficult because, of course, you don't have any resources. You have limited resources. Some of you, I know, I'm reading the comments. You only relied to our videos, which we appreciate. Thank you for that. Um, so yeah, let's move on. So this one is for maternity. We won't be discussing this. This one is for maternity as well. So this one is your this is little Anne. Okay, so little Anne. I don't know. Do you know the story why the mannequin is called Little Anne? Okay, so I won't be discussing the story this evening, but I'll ask you. That will be your assignment. Yeah. If you Google the story behind Little Anne. Okay, it will be an interesting story. If you just make type it on Google, what's the story behind Little Anne? Okay, probably some of you know the story already, but for some people, I mean, it will be like a nice to know. Definitely, it's not a bonus point. I mean, it doesn't make any change on your examination. But again, it's nice to know because of course when you go to practice, you'll never know a random patient might ask, why is it called Little Anne? Okay, so Google it and then try to find out the story behind Little Anne. Okay, so Little Anne is your mannequin for your BLS. Okay, I know some of you you don't want the BLS. Okay, so raise your hand. Okay, so anyone here who's watching the live stream who wants to get the BLS, okay, or anyone here on the in our live stream who doesn't want to get the BLS at all. I know I remember during my time, yeah, a couple of years ago when I did my OSCE, I remember I don't want to do or I don't want to perform the BLS because number one, it's exhausting. Okay. Number two, I don't know if I'm actually performing the appropriate or if I'm actually performing quality compression. But yes, some of you might like it, some of you don't like it. But of course, at the end of the day, we just need to prepare and practice. Okay, practice and practice. That's the only tip I could possibly give you. I remember, of course, I think I remember I got BLS. I passed it the first time for BLS, yeah. It was, of course, challenging because I ran out of breath. So um I remember during my time for BLS, I know you know this already. During my time, you need to hand over for BLS, but now again, you don't need to hand over at the end of the BLS because it's no longer part of the criteria. Okay, because remember, now if you're again starting your study, the handover part is now the evaluation station. Okay, the S bar is now part of evaluation station. That's why on the BLS there's no handover. Okay. So Emma, I heard from my friends that they talk at the end. At the end of the BLS, normally the assessor will just ask you to state the steps of the BLS. That's it. It's not a handover. Okay, because the handover takes place or is required for evaluation station. Okay, S bar. So yeah, check your marking criteria. So next is Sakura. I don't know Sakura. I think it's like a child. So probably um you might not see this on the examination. The sim baby, of course, for midwives. Not this one, not this one. See, this particular marking criteria is still January, okay? So just for the equipment. Again, for the actual marking criteria, it's the latest version is November. Couple of is it November or October? Couple of weeks ago. Not too long ago. I think October or November. Have a look. So, for the API equipment, it says here, so remember what I said earlier. So this will be the setup on the day. So you will see the Bedford doll, the mannequin. The mannequin is normally lying on the bed. Okay, so you will be performing the skills on the mannequin. Yes, that's your mannequin on the day. So uh, if you can see, the mannequin is just beside the drug trolley. So everything will be within reach. Okay, during the day of the exam. Or the bed is just near the drug trolley. So in case the actor lies on the bed, the drug trolley is just close. All right. So the blue tray. So the blue tray is your um, tray. So you when you prepare equipment, let's say your syringes, your what else? Your medication, your let's say your suppository, your gloves, your apron. You will be putting those articles on the blue tray. Okay. So Emma, what if on the day of the examination I cannot find a blue tray? Okay. Whatever tray they have, yeah, whatever tray they have, because probably you've seen the white tray. That's fine. Whatever tray they have on the day of the examination. Normally, the assessor will tell you that the tray is clean and it's ready to use. Okay. Yeah. Normally, the assessor will tell you that information. You don't need to clean it. Yeah, you don't need to clean it. Just ask if the assessor doesn't tell you that information before you start. You may ask the assessor. So, assessor, is my tray clean and ready to use? Yeah. Again, most of the time they will tell you that information before you start. And of course, what else? Call bell. I know whenever you practice, you are saying, press the call bell. Yeah. You are just giving an imaginary call bell whenever you practice. So on the day of the examination, there is an actual call bell. Yeah. On the day of the examination, there will be an actual call bell. So, which looks like this, the one on the screen. So you make sure to give the call bell to your patient. Okay. Again, there will be an actual call bell. So normally call bell, you will find call bells hospital setting. Yeah, of course, if you're at the patient's residence, the patient's house, definitely there's no call bell. Can you imagine a house with a call bell? Yeah. So of course, patient's house, no call bell. Um, what else? Hotel, no call bell. Um, GPs, of course, there's no call bell there. So what setting do you think you will see call bells? Of course, hospital, um, care homes, definitely they have call bells there. All right. So Emmer, so what if I'm at the patient's residence? So what will I give then? So you can give your mobile number. Okay. So for community nurses, normally they have work mobiles. Okay. So Normally, if you're a community nurse, if that's your scenario, in real life, yeah, community nurses, they normally have their mobile phones, yeah. So um they have their work phones, and they normally give their numbers to their patients, yeah, if it's required, okay, if it's necessary. That's another option. That's why probably you've seen some videos saying, I'll give you my number. Of course, you can call it. Normally they give their work mobile or their office number. Okay, so the patient could call them in case there is an emergency. Another another number that they could possibly give is, of course, the GP. Okay, and of course, you can also educate the patient about calling 111 and 999. Okay. I hope, guys, you know the difference between 111 and 999. Yeah, of course, 111, non-urgent calls, and of course, 999 is like life-threatening calls. Let's say stroke, let's say heart attack. There you go. That's your 999. So if you call 999, they will the paramedic will come to you. You will get an ambulance. Yeah. So 111 is non-urgent, non-life-threatening. Um, so that's the community. But of course, if you're in the hospital, you can just, if it's life-threatening, you can just call push the um, what they call this, the crash button. Of course, and of course, you can call the medical team as soon as possible. All right, let's move on. I hope you're enjoying our session. Yeah, I know probably it's this kind of boring. We're only discussing the equipment, but again, it might be useful for some people. So hopefully, you learned something so far. You are hopefully enjoying our session so far. Okay. Again, you can rewatch this video, and of course, please do subscribe to my channel. And if possible, we have a final coaching next week. The link for that is on the comment section. Yeah, it's if you check the pinned comment, that's the link. So you can join our coaching next week. Stethoscope, you don't need this during the day. You are not required to use the stethoscope during your examination. We thought before when we had the new OSCE back in 2021, we thought you will be needing a stethoscope, but of course we learned that a stethoscope is not required during your examination. Yeah. So child resistant bottle. So which station do you think you will see this? The station will be the implementation station. So guys, please do practice. I know some of you're struggling, I know, to open it. Yeah. Um, I don't know if how you can find one, but just in case you manage to find one, try to practice on how to open it. Okay. Um, some of you probably you know how to open this, but for some they are still struggling. Normally for child resistant bottles, we push and then we twist. Yeah, we push and then twist. That's how you open it. Um, we normally use child resistant bottles, so of course for obvious reasons. Okay, so um, children, of course, they won't be able to open it easily. Okay, so it's for adults. Yeah. So you push and then twist. That's how you open it. So try to practice it because of course, um, it might make, you'll never know. It might make a difference on the day of your exam. Okay. So community drug box. Okay. Have you ever seen this? Yeah. Have you ever thought why? I mean, why is there a community drug box? Of course, yeah. Let's just try to put it in context. Yeah. Or let's try to imagine this. Definitely in the hospital. Yeah. There is a drug trolley. Okay. Where else? Care homes, there is a drug trolley, definitely. Okay? Or sometimes, in reality, care homes, normally the patient's medications, they have a cupboard, yeah? So every room in nursing home, they have a cupboard for medication. But still, the nurses, they still have the medication trolley. It depends on the care home, yeah? It depends on their policy and how they do things there. But generally, there's still a drug trolley there. Of course, hospital, obviously, there is a drug trolley. Yeah. But what are the settings wherein there is no drug trolley? Of course, the patient's residence. Yeah. So if in case you will be given a community scenario and you are at the patient's home, we don't expect to see a drug trolley. Okay, so during the examination, you might see a community drug box. Because again, if you think about it, at home, let's say, this is my room, yeah? Oh, this is my room. Do you see any drug trolley in my room? We don't expect to see any drug trolley in my room, yeah? So same in real life. You don't expect to see a drug trolley at in your patient's home. So of course, to mimic that on the examination, you might see a drug box because normally, community nurses they bring their box which contains the medication. All right, okay. So again, probably on the examination, if you don't see a drug box, you might see a drug trolley. But again, in real life, we don't see drug trolleys at home. Let's say if you're visiting the patient in a hotel or in a temporary accommodation, yeah. Of course, you don't bring the. Can you imagine you're bringing the drug trolley? That's heavy. Okay, so it will be illogical um, to bring the drug trolley um, whenever you visit the patient. Of course, it will be handy to bring the drug box instead. Okay, so I don't know if you ever thought about it, but yeah, that's one of the most important information that you might need. So during the examination, if you will be getting the community scenario, you might get a drug box instead of a drug trolley. Okay, but of course, care home, hospital, there will be a drug trolley. Next. Next is our Dynamap with pulse oximeter saturation probe. So Dynamap is the brand of the OBS machine. So in the UK, if you haven't heard this before, OBS is how we refer vital signs in the UK. So OBS means observation. So that's why um, in the ward, if your colleague asks you, have you done the OBS? So OBS, they're referring to the vital signs, observations. Yeah. So this is the machine that we use. It's Dynamap. Okay. So the most important thing that you have to know for this machine is, of course, how to turn it on and where to press for the blood pressure. Yeah. That's the most important thing. How to turn it on and which button to press if you want to check the blood pressure. Because of course, for the saturation, you only need to put the probe on the patient's finger. But of course, you have to check whether the finger is, of course, cold, clammy, there's no nail polish, etc. And of course, you have to select the appropriate cuff size. Yeah. On the day of the examination, you might, again, of course, it depends on the center, they might give you or they might present you with different cup sizes. Yeah. So you might see a small cup size, you might see a medium, a large, and extra large. Of course, you have to select the appropriate Dynamuff or the blood pressure cuff on the day of the examination. Normally, they will put the medium, yeah, because of course the medium will cover most of the patient's arms. But again, definitely there might be an instance wherein the actor is really thin or the actor can be like a bit on a bigger side. Yeah, so of course use your common sense on the day of the exam. And of course for the Dynamap, no, remember for your assessment station there is a briefing there. It tells on the briefing that the equipment is clean and calibrated. So do you need to ask it again? Of course you don't. Yeah, you don't have to ask the assessor again um, and check whether the equipment is clean and calibrated. Emma, what if I ask? Of course, you can ask. Why not? Yeah, but again, it's no longer necessary. Why? Because on the paper, on the briefing, it tells you that the machine is clean and calibrated. So no need to ask. Again, if you want to, why not? Go for it. But again, yeah, I'm just stating the obvious. Next, all right. So this is our disposable bedpan. But to be honest, in real life, this is not a disposable bedpan. This is what we call a commode liner. Yeah, if you haven't seen a commode, if you Google it, commode, and normally this is what we place, of course, before the patient uses the commode. Yeah, it's a commode liner, but it's for some reason they call it here disposable bedpan. If you Google it, disposable bedpan, it's not this. Yeah, there is definitely a disposable bedpan, not this one. But for your exam, again, you might see this definitely. So let's just follow whatever is written on the marking. I mean here on our reading material. So which station do we use this? Of course, for your suppository. Yeah, for your suppository. If you don't see this, just verbalize, of course, that you will. Remember on the marking criteria that you will provide commode, etc. for the patient. And of course, if you haven't seen a drug trolley yet, this is our drug trolley. Yeah. So during the examination, this is your drug trolley. So all the medications will be inside the trolley. And normally, as you saw on the previous pages or the previous page, the drug trolley is just beside the patient. We're nearly done. Um, so during the examination, the test centers will provide you an electronic BNF, yeah, an Android tablet. Okay, says there an Android tablet. So they will be using an Android tablet, and installed on that tablet is your BNF. So it will be easier for you. Let's say you don't know what paracetamol is. You can just simply grab the BNF and then search for the medication. So this is always the question that I receive. Emer, do we need to actually use the BNF? Okay? On the marking criteria, no. Okay? It's not a requirement. But of course, definitely, if you don't know what medication you're about to administer, if you're unsure, use the BNF. But let's say, Emmer, I know what morphine is. I know what paracetamol is. Emmer, do I still need to check the BNF? No need, yeah? No need to check the BNF. Because again, you know it. We learned it at school. Okay, can you imagine? You don't know after finishing university, you don't know any medication. Of course, you know something. You know some medications by heart, definitely. So, if you're confident what paracetamol is, no need to check the BNF. It's not a requirement. But of course, use the BNF if you don't know what the medication you're about to administer. Because remember, on the marking criteria because remember on the marking criteria on the marking criteria of implementation station, you need to give the information um, to the patient what the medication is for. If you forget, the assessor will ask you. Yeah, the assessor might ask you. So, Emmer, what is this medication for? And then you don't know what the answer is. Okay, so again, to recap, if you're confident what the medication is for, no need to check the BNF. If it's your first time hearing the medication, or if you're unsure, of course, you can refer to the BNF. Yeah, that's I always get this question. Fob watch. So fob watch, you will be using it during your assessment station, and I think some people they reported that, I mean, not reported, but they shared that during NG insertion they also saw a fob watch. What else? You will also see a fob watch during your MSU. To time, of course, the strip. What other station can you think that you might need the fob watch? Glucometer, of course. Probably most of you watching this live stream, you've seen a glucometer before. So it will just be a simple glucometer. Of course, if you're working in the hospital, this is not the glucometer we're using. Yeah, we normally use a heavy duty um blood sugar monitoring machine. Yeah, it's not this one because normally this glucometer, it's for I mean, it's for everyday use for people as diabetic. So if they want to check their blood sugar at home, of course, this is what they use because of course it's simple. But the one in the hospital is different. Yep. But again, you will just be using a simple glucometer on the exam. So how this works? Of course, take the sample, insert the strip, and that's it. Yeah, once you insert the strip, it will give you the reading. That's it. The hospital machine, of course, it's complicated. Yeah, some machine you have to, of course, scan the patient first, etc. You do the QC test, etc. And then of course this is the glucose test strip, uh, which is of course goes with the machine. So your glycerin suppository. So we know what the medication. I mean, you have to administer during suppository. It's glycerin. Yeah. If you don't know what this medication is, go to your BNF. Yeah. Infrared thermometer, which station? So we will be using the infrared thermometer during your assessment station. So remember what letter of A to E? So it's your E for exposure, the temperature. Yeah. So you will be using infrared thermometer. I know the old OSCE we use the tympanic. I don't know. In our video, did we use the tympanic? I think we used the infrared. So you will be using the infrared thermometer. Okay. Just make sure. So I don't know if you know this. For infrared thermometer, if you have one, try to check it. There are different settings. Yeah, we have the body. I think we have the surface, and there's another mode. So make sure it's body. Yeah, that you're checking body temperature, because there's also an option there to check surface temperature. Let's say I think it's referring to inanimate objects. Yeah, surface, the surface of something. So yeah, if you have one, try and check your infrared thermometer. There are different settings. Yeah, but normally, of course, the assessor normally will put it on the appropriate setting on the day. Medicine pot, this is normally for pediatrics, because for pediatrics OSCE, um, there are scenarios, or there will be instances that they will be giving liquid medication, but not for your examination, not for the adult. Even for learning disability, if any one of you watching this live stream who will be doing the learning disability, there is also a scenario wherein you are required to give liquid medication. So normally liquid medication is for pediatric OSCE and for learning disability. Yeah, there will be medications, some medications there. Um, you are required to give it in liquid form, not tablet. Or you have, of course, an option of using a spoon. Not for you, not for you. Pen torch, of course. Which scenario or which station? So you will be using this during your subdural hematoma, during your GCS. Okay, that's the only station you will be using a pen torch. Um, yeah, in the UK, we normally call this a pen torch, a torch. So the pH indicator, not this one. There's another one. I think it's at the bottom of the page. So Pinard, not for you guys. It's for midwives. Yeah, Pinard is what we use um to auscultate for fetal heart sounds. Yeah, I think I forgot what it's formally called. But yeah, have a look, Google it, and then put in the comment section. There is a formal name for Pinard. So plinth. So normally during your BLS, the mannequin will be here. Okay, during your BLS, normally the mannequin is here. So if you're going to perform, or if they give you, I mean, the scale BLS, you will not the mannequin will not be in the floor. Okay, because of course some people, they're having difficulty kneeling, and sometimes, of course, I mean, um it's painful after some time if you kneel during BLS. Yeah, so that's why on the examination, the mannequin will be um in a bed. Yeah, so it will be in this bed, similar bed, and it will be the bed will be hard. Okay, so because I know sometimes beds can be really soft, and sometimes when you perform the BLS, it's difficult to do the compression. Yeah, so so during the examination, they normally place the mannequin in this type of bed, because this one is hard. All right. So I know some of you are, whenever you practice BLS, you are kneeling on the floor. Okay. Normally on the exam you don't do that, because I know some of you have knee problems. Okay, and of course, again, for some it will be challenging to kneel on the floor. Um, what else? We're nearly there. Okay, so red ID band. Of course, we learned if your patient has allergy, you will see the red ID band. Okay, so the name of the allergy will be written on the ID, on this particular ID band, which is the red one. Reserve mask. You will see this during your administration of oxygen. Okay, so this will be the device that you will see again as of present time. Okay, as of recording, as of today, you are using I mean, the equipment or the device that you will be using for your oxygen is your reservo mask. Okay, it's implied before. I think in the old criteria it says the reserva mass, but they got rid of the word reserva mass. It's just implied that you will be using a reserva mass. And of course, a single use lancet for your glucose monitoring. Definitely you have to bring your sharps bin, because you have to discard this on the sharps bin. And of course, we have the white ID band. So the white ID band contains the patient's name, date of birth, the NHS or the MRN number. Okay, so that's the content of the white ID band. Okay, of course, a lot of people fail the examination because of not counter checking the document with the ID band. Okay, so when you perform assessment station, make sure to counter check your document with your ID band. Okay, again, if you're in the hospital setting, for your same goes with your implementation station. If in the hospital setting, of course, we expect to see an ID band. Um, Definitely compare your document, your drug chart, if you're doing implementation station with the patient's ID band, and of course, confirm again verbally. So this one is our what do you call this? This is our administration of inhaled medication. This is our what do you call this? Spacer. There you go. Well done. Okay. So let me ask you guys, why do we need a spacer when we administer inhaled medication? Okay. So do you know the reason behind it? So while you're typing your answers, couple of commercials. Please do register for our final coaching next week. And of course, if you can, please donate to Victa. I will be supporting Victa next year for the London Marathon. Okay, so all the proceeds will go to Victa. Okay, so that's I will put the link on on the comment section if you want to donate. If you can, please donate. Yep. Thank you in advance. And of course, please do subscribe to my channel. Okay. All right. Going back to the question, why do we think we need to um, use a spacer when we administer inhaled medication? Any answers? Try to think what the answer is. Any answers? Of course, thank you. Of course, we need the spacer definitely because it will help the medication go directly to the patient's lungs. Because then the tendency is if you don't use a spacer, the medication will just stay on the patient's mouth. Okay, just here. Okay, and of course, the efficacy of the medication will be reduced because instead of the medication going to the lungs, it will lodge to the patient's mouth, back of the throat, tongue. There you go. That's why we use the spacer. So, guys, whenever you administer inhaler, please use a spacer. So we have a spacer for adult. Of course, we also have a spacer for children. Um, the plaster, of course, I think it's for IM and for subcut. It's on the marking criteria. Of course, our bag valve mask. So the bag valve mask is also known as your ambubag. Yes, so ambubag is the brand name. Okay, so ambubag. So you can call it ambubag or BVM. Okay, BVM or bag valve mask. It doesn't really matter. But normally, I mean, ambubag is the brand. Okay, so the proper name for this is bag valve mask or the BVM. What else? Of course, our wipes. The disposable mouthpiece. It goes with the peak flow. Yeah, it goes with your peak flow meter. Not yours. This one is of course the flow meter and oxygen tubing. It's for your administration of oxygen. Definitely, you have to attach the tube here and then to deliver the required oxygen liter per minute. The flushable port, this is used for your IV, for your VIP and administration of IV medication. So to flush the cannula, definitely you will be inserting the flush here on the port. Gallipot, it's for your NG. And of course, you might also see this for your suctioning. So, suction. If not this, you might see like a cup because the gallipot acts as a receptacle. Incontinence pad is for your suppository. Of course, insulin vial is for your insulin, yeah, for administration of subcutaneous injection. Sorry, my nose is itchy. Um, I don't know if you know this. Just a trivia. I learned this somewhere. I can't remember where. For you to avoid sneezing, yeah, you I mean, place your tongue or try to. I mean, I don't know how to say it properly. Um, Using your tongue, touch the upper palate. But there you go. I don't know if I explained properly, but yeah, it will prevent you from sneezing. So, intravenous. So this one, of course, gauge 20. You will see this cannula during, of course, your VIP. Yeah, you put during your insertion of administration of intravenous fluid. So which one is bigger, 20 or 16 for IV for cannula? Which gauge is bigger, 20 or 16? Any answer? Which one is bigger? The gray one or the pink one? So for cannulas, um normally the lower the number, the bigger the needle is. So 16 is definitely bigger than 20. Okay, for cannula. So no, so this one is too big. Yeah, this one is too big. So don't use it for IV. Uh, it says here midwifery. Yeah, so for midwifery, normally 16 is. I think we sometimes use this kind of needle for the say spinal tap because it's too big. Yeah. I might be wrong, but yeah, this one is really big because normally when we insert, yeah, it says here for midwifery, but for in normal IV insertion, it's either 18. Of course, we use 18 if you're transfusing blood, or 20 if you're transfusing blood. Yeah, or if you're giving multiple antibiotics, definitely go for 20. Or if you can, 18, but again, it's painful. Um, IV extension set. So you might see this during your VIP or during your um, administration of IV medication. The most important thing is if you see this, I don't know if probably you've seen this before, you need to unclamp. Yeah, unclamp and clamp it. Okay, just in case you see this attached to your port for your administration of IV medication, of course, um, unclamp this before giving the medication, and of course clamp it afterwards, um, just in case you see this. Okay, remember the flushable IV port, you might see that as well instead of this, because again on the marking criteria it doesn't say that you have to clamp and unclamp. Just in case, of course, use your critical thinking. Kidney dish, or the kidney basin, you will see this during your NG insertion. Of course, your receptacle. Remember, there is a possibility of the patient to vomit. Okay. Of course, when you insert your NG, your catheter. Okay. So um, there is a chance, or there's a possibility of the patient vomiting. Okay. In real life, of course, you don't want the patient to vomit or to puke to you. Okay. At least there's a receptacle. Lubricating gel, you will see this equipment or this material during your suppository. Of course, you have to lubricate the suppository. So the nasogastric tube, or our tube for the NG, this is the tube that you will be using. Okay, so in the hospital normally there is a guide wire. Okay, so if you're in the hospital setting, there is normally a guide wire, and we normally use the guide wire to identified, I mean, to make sure that the placement is correct, isn't it? Because it's metal, you can see it under X-ray. But in the community, we don't have of course that you can request in the community as well. But again, it's more challenging to request X-ray in the community, yeah, because again, at the end of the day, you have to bring the patient to the hospital. Okay, so that's why we will be using this type of nasogastric tube. Okay, we don't need the guide wire. Okay, we don't need to check the X-ray because again, on the marking criteria, what's the best way or what is the way of checking if that it's actually in the stomach is the pH. Okay, we have to check the pH of the gastric content. Okay, so make sure it's less than 5.5 and below. Okay, there you go. That's the normal pH for your gastric content to make sure that you're inside the stomach. That the tube is in the proper placement. So the red blunt filled needle. So you will be using this to aspirate the medication for your IM. Okay, so for IM only. Okay, because for subcut, you will be using insulin needle, and insulin needle we cannot change the needle, yeah, because it's just, I mean, you cannot change the needle of an insulin needle, yeah. So remember, guys, insulin needle, you only use it for insulin, yeah. Don't use it for any other. Don't use it for other subcutaneous medication. Of course, there will be different needle for subcutaneous medication. If you're giving insulin, please use insulin syringe only, yeah, because I don't know, probably you've heard this news before. Um, like never event wherein the healthcare professional, instead of using insulin syringe, they use a different needle for when they administer insulin. Remember, for insulin we are using units. Okay, remember that for insulin we're using units. Going back to red fill needle, you'll only see this during IM because of course you have to change the needle after aspirating off the medication, and you will see gauge 21 or 23, either. Okay, you can use either. Of course, consider the patient size. Definitely, if the patient is bigger, probably you might want to use the bigger needle. Okay, so if the patient is slimmer or thin, or um, you might want to use the smaller needle. Okay, of course, which one is bigger, 21 or 23? Of course, going back to what I said earlier, the lower the number for catheter, for cannula, the bigger. So definitely 21 is bigger than 23. That is why 25, the orange one, we use 25 for subcutaneous medication. Again, except insulin, yeah? Of course, insulin, you have to use insulin needle because um again, insulin we use units, not mils. Of course, gauze, you will see this in different stations. Try to think what stations are those. So this one, I won't be discussing this because at the moment you are not required to use Venturi mask. Yeah. If you're not familiar what Venturi mask is, just of course Google it. Yeah. For now, again, I won't be discussing this because you are not required to give this or use this. But just in case, yeah, Venturi mask. Um, every color corresponds to percentage of oxygen you have to deliver. So they say 24, there is a particular oxygen level that you have to use this, okay, only. You cannot use this for all um, what they call this, um, delivery of oxygen. So you have to Google it and study. Yeah, at the moment we will not discuss this further because what time is it now? We are running out of time. Just have a look. So you have Venturi mask. It has different colors. It's part of your high flow oxygen. Peak flow meter. Of course, for peak flow, for your non-traumatic clamp, you will be using this for CSU, for catheter sample of urine. Of course, you have to clamp for you to be able to collect the sample. And common mistake for this station is the candidates forget to unclamp. Yeah, make sure to unclamp this after at the end. um Injection swab, of course, prosthetic finger. So you will be seeing the prosthetic finger when you perform your blood glucose monitoring. Okay, when you perform your blood glucose monitoring, because you are not pricking. Remember the doll earlier. You are not pricking the doll directly. They normally place a prosthetic finger. Okay, so because this prosthetic finger is intended to be used for blood sugar monitoring. You are not pricking the assessor's finger. Yeah, you are not pricking the assessor's finger. You are actually, I mean, you're using the prosthetic finger. We are nearly there. So this one, our multi-sticks for urinalysis. Definitely. I know some of you don't like urinalysis. I probably we can do urinalysis next week, yeah, if you like. Just put it in the comment section. What station or what topic do you want to discuss next week? I hope our session has been useful so far. Sodium chloride sachet, you will be seeing this piece of equipment or this medication. Of course, this is a medication during our ANTT. Okay, so this will be your saline. Sputum pot, there is no station so far which requires sputum. Sterile dressing, of course, for your ANTT. The brand is Me4. Ever since the brand is Me4, but again, remember going back to the disclaimer on the day of the examination, it might be a different brand. But ever since, even during my examination, we used Me4 before. Sterile forceps, you might, of course, you will see this during ANTT. If you're confident using this, why not? If not, you can just, of course, use the orange bag. But definitely, you will see forceps during ANTT. Again, if you want to just use the orange bag, that's fine. If you want to use the forceps, that is also fine. Um, Sterile gloves, of course. Suction machine. Have you ever seen one before? So normally this one you will see this in the hospital. In care homes they also have one. Okay, they might have a different brand though. So this one is for your suctioning definitely. So what's our suction pressure? I don't know if you remember. What's the pressure for suctioning? So it's, let's see if you still know it. I don't know if you're still awake. Can you help me? What is our pressure, normal pressure for suction? Give me the range. Who can help me answer the question? What's our normal suction pressure? So thank you. So the suction pressure is 12 to 20 kilopascals, or equivalent to 100 to 150 millimeter mercury according to the marking criteria. Okay, and it says here sizes 6, 8, 10. So based on the marking criteria, because of course it's an adult patient, you will be using either 10 or 12. Okay, French, um 10 or 12. So that's the size of your catheter for the examination. um 10 is black, 12 is white. Okay, that's the color. Just don't rely solely on the color. Of course, on the examination you can read the packet. Yeah, read the label. Okay, what French you're using. Again, regardless, either again 10 or 12. Okay, only because you're dealing with an adult patient. Of course, if your patient is pediatric or patient is like, of course, um, smaller, definitely it will be a different French. But again, for adults, 10 or 12, black or white. Okay, that's the color of the catheter. Where are we now? We're nearly there. Of course, your internal syringe, you will be seeing the 61 for your NG insertion. This is the insulin syringe I'm referring to, the safety glide insulin. So it's called a safety glide because after you use this one, you have to push the white part and then it will automatically lock. Okay, so you have to push the white. I think push up. I think if I'm not mistaken, if I can still remember it, you have to push up and then it will lock. So once you push the white part of the syringe, you can no longer use it. Okay, it will lock forever. Of course, unless you're forced to open it. Yeah. It's your insulin syringe. Oh, again, only use insulin syringe for insulin. because you will be seeing units instead of mils. What else? Of course, this is our pre-filled syringe or your Posiflash. Again, Posiflash is the brand. Yeah, BD Posiflash is the brand, but it's called a pre-filled syringe in general. Our different sizes of syringes. What else? Inhaler, of course, you will be seeing this equipment during your administration of inhaled medication. Like we discussed earlier, of course, you will be using your spacer. There you go. Specimen container for your sample of urine. Catheter, of course, for your removal of urinary catheter. The most important thing you have to remember here is where to find, the documentation in terms of how many mils used to inflate the balloon of the catheter. Okay, so you will see this here. I don't know if you can see it. There will be a small writing here. Um, Normally it stays where on the port where you used to inflate the balloon, yeah, or the catheter. So there will be writings in there stating how much fluid was used to inflate the balloon. Okay, which is normally 10 mils. Okay. You can also see that on the marking criteria. Of course, vomit bowl in case you don't have the kidney basin. This will be an alternative. Water for injection. So normally for IM, your hydroxycobalamin will be here. Some people, when they share their examination, according to them, some of them, what they experience, the hydroxycobalamin was in a vial, okay? In a vial. Again, some people experience that. Yeah, they said, Emer, the hydroxycobalamin is in a vial, in a multi-drug, um, multi-dose vial. Okay, so but other people, like me when I did my examination a while ago, and most of our students, what they experience, the hydroxycobalamin is here in a plastic ampule. But it will tell you that this is a glass ampule. Of course, you have to treat the ampule as glass. Okay, so be careful. It will be a sharp object. Of course, you need your sharps bin. And of course, your wound pack for your ANTP. So calculator, you will see the calculator when you um, do your fluid balance. Yeah, when you do your fluid balance, you will see. Thank you for the answers. Sorry, I didn't see the comment. You will see the calculator, or you will use the calculator for your fluid balance. Okay, for your fluid balance. So you don't need to buy your calculator, but they will provide the calculator on the day. And of course, you have different colored pens. So most of the station, you will be using the black pen. Okay, so most of the stations you will be using black pen. What are the stations? Say planning, your EBP, professional values. Um, when you document the skills, I mean when you do the documentation for certain skills, for most of the skills, it will be black pen. So you will be using blue pen for your evaluation station. So when you do your notes, when you write your notes for your S bar, you will be using a blue pen. Okay, they will provide the pen. Don't worry, you don't have to buy it. Green pen. If you read, if you read the brief for assessment station, you will be using a green pen. So which means when you complete your new score, when you complete your GCS, your neurological chart, when you complete your must, when you complete your PHQ-9, what else? When you complete your 6 CIT, you will be using green pen. Again, they will provide it on the day. Um, those are the pens that you will be using. Ruler, you will be using the ruler for fluid balance. Okay, so they will give you a ruler for fluid balance. So when you transpose the information from the scenario to your actual paper, um, you I mean, the reason for that is for you to avoid placing the number on the wrong box. Okay, because most of the reason why people are failing fluid balance is because when you put the number on the wrong box, it will affect the total output or the total input. Yeah, I don't know if have you ever experienced that, calculating the wrong output, etc. So you may still come up with the correct final answer or total answer, but again, that it will affect the total hour in the hourly total, isn't it? I don't know. Try to practice it. If you put it in the wrong box, it will definitely affect the hour total. But you will still come up with the same final answer or the correct final answer. Okay, so please, fluid balance is simple compared to the other station, but of course, there's still a chance of failing this station. So please be careful when you transpose the numbers from your scenario to your actual paper. Okay. And of course, the timer. This is the timer on the day of the examination. It will be big. Normally, the assessor will give you warning. Let's say 5 minutes left, 2 minutes left, or 1 minute left. Okay, so normally they give you warning. But of course, it will be your responsibility to look at the timer frequently. Okay, so of course, you don't have the luxury of time during the day of the exams. It is important to keep track or be mindful how much time remaining or time left when you perform the skill. Okay, so during the examination, the total exam time is 3 hours. So it will be the longest 3 hours of your lives. Okay, so I think that's the end of our um, session. Okay? So, guys, I really hope you learned something this evening. I hope you enjoyed it. So, for those people who joined a bit late, you can still rewatch this video from the very beginning. And of course, please like this video. Please do share this. Invite your friends. I'll do another live stream next week. I'm really sorry we skipped last week because I was busy. But we'll do it probably on a Wednesday or on a Thursday. Please do subscribe and of course, click the notification bell so you know when we are going live. Okay? And of course, please do follow me on other social media platforms. Follow me on X, Twitter, previously Twitter, okay, on my Facebook page, Instagram, of course, and TikTok. We have different contents on different social media platforms, right? So I hope you enjoy it. Yeah. Do you have any questions? So before we call it a night, I'll give you an opportunity to ask question. Yeah, let me know if you have any questions to ask before we say goodnight to each other. Another day tomorrow. Okay, so for those people who will be doing the examination very soon, like tomorrow or the next coming days, um, good luck on your examination, of course. I wish you the best. Um, so once you pass the OSCE, it's just the beginning. Yeah, it's just the beginning. And of course, if you fail the examination, I know it will be difficult, definitely. But um, if you need, of course, some help, you can always go to your friends. You can email me if you have any questions. I'll try and answer as soon as possible. But don't lose hope, yeah? Um, if you're, of course, religious, if you're spiritual, of course, pray, okay, if that will help you, yeah? If, of course, if you're not very religious, etc., I hope you have friends that they can help you along the way, definitely. If you don't have, I mean, if you're not friendly, I hope there is someone who could support you. Yeah, like your instructors, your colleagues, your managers, definitely they will be supporting you along the way. But yeah, I wish you all the best for examination, and of course, I do enjoy reading. Whenever you tell me that you passed the examination, I'm really happy to hear your stories. But yeah, thank you very much. I think we have to call it a night. Um, it's getting late now. Thank you for those people who stayed until this very, what time is it now? Until 10 o'clock. So thank you. And I'll see you in the next one. If you want to suggest any topics for next time, please do, I mean, leave it on the comment section or leave it in any of the videos um on my channel. Okay? See you next time, guys. Have a good evening and stay safe and stay dry. I know it's raining. See you in the next one.